And what do we do about it? Fatigue is the most commonly mentioned symptom and the most bothersome for many. Let's talk about it and share practical tips and tricks on how to deal with it. And we are going to have a great presentation of Dr. Natasha Jordan, and I will introduce her to you later. First, well, I have a little bit of a technical problem.
What now?
I can't move to my next slide.
Okay. Is that the next
Yes,
slide?
thank you. Oh, back. Yeah.
Okay, so 2 minutes.
Thank you. First, a few rules. Please ensure that your microphone and video are turned off. Please turn your microphone and video on only if you are speaking. Please be aware that this session is recorded and only use the raise hand function, bottom middle of the screen, if you absolutely need to get our attention during sessions. We will respond to you in chat. Please use the chat function to ask any questions or for any comments you may have. And please be patient with us. We will ensure your questions are answered. If you have any technical problems, try logging out from Zoom and logging back in. First, we have a few questions for you. So could you start also the quiz? One of the questions we like to ask you, and not one question is good or bad, do you feel tired at this point of day? And you can choose from no, thank you, just a bit, quite tired, very tired, and I'm sleeping already. I don't hope you are doing that, but so let's see how the situation is at the moment about fatigue. Well, and then you can see that a lot of us are quite tired and that there are only a few who are not very tired. No one is sleeping, fortunately. And there are also quite a few people who are just a bit tired, sorry. The next question is, how comparable is that to the days where you wake up with lupus fatigue? I am more tired now than those days. It is about the same. In those days, I am more tired early morning than I am now. There is no comparison. When I have lupus fatigue, it is a lot more. I am not often facing lupus fatigue or none of the above. So what we see is that there are a lot of people that had answered that their fatigue is about the same as other days, and that there is no comparison when I have lupus fatigue. Sorry.
And if I could just say, we have 5 people from Facebook who have just also taken part by answering with a number. They're also voting. 3 of them are saying 4, which is there is no comparison, and one of them is saying 2. It's about the same.
Okay. Well, that were the 2 questions we would like to have you answered. And if my computer is working now, but it doesn't end. I have a little bit of technical problems. I'm sorry for that.
You want to go down?
Yes. So I will introduce to you Dr. Natasha Jordan, who is going to give the presentation about fatigue for us today. And Dr. Natasha Jordan is a consultant rheumatologist. Her major clinical and research interests are autoimmune connective tissue diseases and systemic vasculitis. Dr. Jordan studied medicine at University College Dublin, followed by higher specialist training in general internal medicine and rheumatology. She subsequently worked for 5 years at the Louise Coote Lupus Unit, St. Thomas Hospital in London. She has been the recipient of an Arthritis Research UK Fellowship and the Graham Hughes Clinical Research Fellowship, allowing her to undertake research in the areas of SLE and vasculitis. She obtained her PhD from King's College London, investigating the genetics of lupus nephritis. Dr. Jordan has a keen interest in patients with lupus and other autorheumatic diseases. Dr. Jordan, I would like to ask you to start your presentation.
So I think that should be possible now. So can you see my slides and can you hear me?
Yes.
Perfect. So thank you very much for inviting me to speak with you today. It's a real pleasure. I work in Addenbrooke's Hospital in Cambridge, but right now I'm actually in Dublin, in Ireland, which is uncharacteristically sunny for late September, or actually uncharacteristically sunny for Ireland in general, but we're not complaining. So mainly in my clinical practice, I treat patients with lupus. And one of the commonest issues that we encounter is fatigue. So I'm really pleased that you asked me to speak about this today. So what is fatigue? How can you, if you had to explain this to somebody else, what would you say? Well, it's quite difficult to explain actually, because it is a multifaceted entity. There are lots of sides to it, and it can be very broadly defined. And that makes understanding the cause of fatigue and how it manifests particularly difficult, and especially so in diverse diseases and complicated diseases that are caused by autoimmunity, such as lupus. But in general, I think we can define lupus, or define fatigue rather, as debilitating periods of pure exhaustion that interfere with a person's normal activities in their daily life. So it goes well beyond just feeling slightly tired. It's something that actually negatively impacts on your life and stops you doing things. So when patients talk to me about fatigue, they can use a number of different words. They can say overtired, lethargic. Some people say they feel weak. There are different ways of verbalizing this. It's also important to recognize that fatigue can be physical, mental, and emotional. So to start with the physical fatigue, this is when a person's body and limbs feel extremely heavy. It's difficult and cumbersome to move. Some of my patients will tell me it feels like having a flu all the time, and that all their energy has just disappeared. What is actually often more upsetting for patients is the mental fatigue. Patients saying, I can't think straight, I can't concentrate, I've lost my motivation, and that can be very upsetting and distressing. As can the emotional fatigue, where just everything is too much, and a person can feel very irritable, feel very low, and even tearful in trying to cope with everything in their everyday life. So how common is fatigue in lupus? As in the introduction, it's incredibly common. So 80 to 90%, so look at that, almost all patients with lupus report that fatigue is their most profound and debilitating symptom. And severe fatigue is present in more than half of patients. Our patients will say that the single most troublesome symptom they have, as part of their lupus that negatively impacts on their quality of life is indeed fatigue. So it's a really common and significant issue for our patients. So how does this then impact on a person's life? Well, fatigue has a very wide-ranging effect on quality of life for a person that can disrupt their everyday daily function. And this will have implications for their work, employment and career, for their ability to do physical exercise and leisure activity and hobbies. It's known that there's a high prevalence of employment disability related to fatigue in patients with lupus. We have to also think of our younger patients with lupus, because lupus can develop very often in late childhood and teens. And fatigue is very significant in this group because with the impaired concentration I mentioned, this could have important implications on a person's education and their educational attainment and whether they go to college or university. And this obviously has an impact on their future career and job prospects. So extremely important. So one thing, there are a lot of things we don't know about fatigue, but one thing that we know for sure is that it's a multifactorial issue. So lots of different factors all feeding in. I really like this slide. It's from a charity in the UK called Versus Arthritis, which summarizes very well the multifactorial nature of fatigue. So if we start at 12 noon at the top, active disease is mentioned, and I'll talk about that in a moment. Having a long-term condition, not just lupus, but other long-term conditions are very often associated and contribute to fatigue. Certain medications. Pain is a huge issue. I think it's very hard to be in pain, certainly significant long-standing pain, and not have fatigue as part of that. Poor nutrition, muscle weakness, overdoing it. So I'm going to talk about that later when we talk about pacing and planning. Stress, anxiety, low mood, all very interlinked with fatigue. And a big important factor is sleep quality. And again, I'm going to talk about that for quite some time in a moment. So this is an area that's very frustrating for patients. It's the relationship between lupus disease activity and fatigue. So you see this doctor in the cartoon here who's looking at the patient's lab results and says, your lab results look great. Congratulations. You must be feeling much better. And I have done a great, fantastic job as a doctor. You're the picture of health. Now, that's his opinion. I think you'll imagine that the lady has a very different opinion and she's not looking that impressed and she's probably not feeling very well. And this is where the blood tests don't match up with what the patient is feeling. And I think fatigue fits into this scenario very well. So your rheumatologist or your nephrologist says, oh, your lupus blood test, so I've written here serology, so that's your antibodies, your complement levels. So they're all looking fantastic. Your lupus is controlled by the medications you're on, but you're still feeling very marked levels of fatigue, despite the disease apparently being in remission. So there's a mismatch that can be very frustrating for patients. Briefly, medications and fatigue. So we use corticosteroids, such as prednisolone, a lot. We try to use them as little and infrequently as we can, but we do rely on them still very much. Steroids can interfere with sleep quality, particularly at higher doses, and this will obviously exacerbate fatigue. Other medications that can worsen fatigue include opiate-based analgesia or pain medications, and certain antidepressants or anxiety medications have sedating side effects, which then worsens fatigue. Now, fibromyalgia, many of you may have heard about. It's a very common condition. It can have a number of features, but the three main features are significant fatigue, sleep disruption, or what we call non-restorative sleep, and widespread discomfort throughout the body. It's said that 10 to 25% of patients with lupus also have fibromyalgia. I think that's probably an underestimate. I would think it's probably higher than that. And this will certainly worsen fatigue. Now, sleep disturbance in lupus is a very interesting area. It's an area that there has been quite a bit of research in. And sleep disturbance is not one entity. It can be a number of things. It can be difficulty initiating sleep. That's getting to sleep in the first instance. It can be difficulty maintaining sleep. So you get to sleep, but you keep waking up. And it can be early morning awakening. So you go to bed, you sleep for 5 hours, and then you're awake and it's 3 o'clock. And it's very frustrating. So this particular study by Palagini in just over 80 females with lupus reported that insomnia was very common. And they found that nearly 2/3 of lupus patients in that study had poor quality sleep or this early morning awakening that I mentioned. So a very key predictor of poor quality sleep is a person having pain. So when a patient with lupus has pain, they'll have more difficulty trying to fall asleep when you compare that to healthy controls or people that don't have pain. And there'll also be more awakening during the night. And when this was examined more closely in lupus patients, other factors that led to sleep disturbance were having respiratory symptoms, so lung symptoms like, for example, shortness of breath when lying flat, and actually restless leg syndrome was quite common in the patient group, and this also disrupted sleep. Mood, a low mood in particular, can result in sleep disturbance, and again will have a knock-on effect of causing fatigue. So there have been a number of studies that have highlighted high levels of depression and anxiety in patients with lupus. And both of these things can negatively impact on sleep quality. So a particular study by Da Costa looked at 100, again, women with lupus. A lot of these studies mainly have women because we know lupus occurs much more commonly in females. So in this study, depressed mood and lack of physical activity were found to significantly contribute to poor sleep quality. So we see these themes coming through again and again. So this is a study actually from St. Thomas's Hospital, where I did most of my training. And it looked again at sleep disorders in lupus, just over 40 female lupus patients, and then 10 controls. And they looked at what they called overnight polysonography. So this was basically overnight sleep signals, EEG, which is looking at brain waves, and they also looked at breathing during the study. And this study is almost 20 years old now, but I think if you did the study again today, you'd find the same results. So in the study, they found that lupus patients had reduced sleep efficiency. Sleep efficiency is how quickly it takes you to get to sleep. They also had increased wake time after sleep onset. So you go to bed at 10 o'clock and how much awake time you have after that when you should be actually asleep. They had more light sleep or shallow sleep. And this is the type of sleep that is non-restorative. It's not quality sleep that makes you refresh the next day. And 15% of the group had breathing alterations during sleep, which is interesting. And that brings me on to sleep apnea, which is a breathing issue during sleep. And this was seen in patients who had a higher body mass index. And some clues where this could be an issue that you might need to talk to your doctor about is if there's a history of loud snoring or excessive daytime sleepiness. So by sleepiness, I don't mean feeling tired. I mean, you're sitting on the sofa speaking to someone and the next second you're gone. That can be a sign of sleep apnea. And there are masks that you can wear at night that help sleep apnea. So if you have those symptoms, it would be worth discussing those with your physician. So even though they found these, what they call abnormalities of sleep architecture, or what the build or the structure of sleep should look like, they still weren't enough issues there to fully explain the severity of fatigue in lupus patients. So the sleep issue is part of it, but not the whole story. This is another story from Toronto Lupus Clinic, again, a very world-renowned lupus group who do a lot of study about neurological and psychiatric aspects of lupus. It's their specialty. And they looked at 100 women with lupus using a particular score called the Pittsburgh Sleep Quality Index. So a particular scoring mechanism to find out how good your sleep is. And using that, they found that over 50% of patients who had poor sleep quality had these features that were tied in: depression, use of corticosteroids, functional disability, and lack of exercise. So we see this kind of domino effect emerging, that you have physical deconditioning. So patients with chronic diseases, so chronic disease is not like an infection that you get for a week or two and then it resolves. It's a condition you're going to have for months or years. And lupus is that type of condition. So patients get entrapped in what we call a vicious cycle. If they are fatigued or feeling low, they can develop disability related to the underlying disease. This then leads the patient to have a negative impact on their quality of life. They stay at home because they're not able to get to work or education or have hobbies. This leads them to what we call a sedentary state. So they're on the couch or in bed. And this leads to more fatigue. And then they feel even more low. And you have this, as I said, a domino effect or a vicious cycle. So looking at fitness, aerobic fitness, or physical activity, I've mentioned that a few times, and it has been studied in lupus. So again, this was a study at St. Thomas's in London about 20 years ago by the same researcher, where they compared sedentary controls. So that was people who didn't have lupus but did not have a particularly active lifestyle. And they looked at almost 100 lupus patients. Perhaps the sedentary controls were the staff at the lupus unit. I don't know. So when they compared the lupus patients to those controls, even though the controls weren't particularly active, the lupus patients were still less fit. They had reduced exercise capacity and reduced muscle strength, had poor sleep quality, more depression, and more fatigue. So all of these factors were, as I said, perpetuating and worsening and associated with each other. So if we know that aerobic exercise can help fatigue, why aren't we encouraging our patients to do that? Why haven't we solved this problem? Because that's much more easily said than done. Patients may be worried that certain physical activities might cause them more pain or cause their lupus to flare. So some of these barriers are what we call perceived, that the patient thinks it might be a problem, but perhaps it's not. But perhaps we as physicians or those looking after lupus patients haven't really explained well enough that these things won't cause a lupus flare. So this study by Mansusko looked at 50 lupus patients and tried to figure out, well, what were the physical barriers to aerobic exercise and physical activity? What was stopping the patients? So just over half of patients said it was their joint, their musculoskeletal symptoms were the most frequent barrier to exercising. Fatigue was actually number 2 for once. The second commonest barrier, and other barriers or blocks against exercise were neuropathy or a nerve problem, osteoporosis. So maybe that person, osteoporosis is brittle, weak bone. So maybe the person was afraid they would have a fall and break a bone. Pleurisy, which is an inflammation in the lung lining, which could cause shortness of breath. So I can understand that. An interesting one was the photosensitivity, the skin sensitivity in lupus to the sun. So perhaps patients were scared to go outside to exercise because we've been telling them to avoid the sun. So I think we need to have a better conversation about that. And serositis, again, is inflammation like pleurisy in the lung or heart lining that can cause shortness of breath. So I can see how that might limit physical activity. Just jumping in a slightly different direction, what we call fatigue biomarkers. So this is what we're lacking. A biomarker is a blood test that gives us an indication of what's happening in the body. And if we had a blood test that measured fatigue, that would be really helpful. But we don't have that. We don't have a good blood test that can consistently correlate or measure fatigue in lupus patients. Because if we had that, we could understand the causes of fatigue better, and also we could potentially get better targeted treatments to help fatigue. But there is still a paucity or a lack of evidence for biomarkers for fatigue and lupus, and I really hope this is an area of research in the future. I think the last thing I'm going to talk about before I talk about how we're going to tackle fatigue, I just want to mention vitamin D. So vitamin D deficiency, or having a low vitamin D level, is very prevalent, very, very common in lupus, partially because of, again, the photosensitivity. We tell our patients to avoid sun exposure because it can flare lupus, but actually sun is an important part of how vitamin D is developed in the body. And also we use a lot of steroids, which kind of are counteractive to vitamin D. So we've had a lot of research so far about vitamin D and how it could be involved in how lupus develops, how lupus flares, and how disease activity happens. But there's actually not very much in the literature or the research about vitamin D and fatigue. And what there is a bit controversial. One study contradicts another study, as I'll show you here. So this is a review article from the journal Lupus, where everything in that journal is about lupus. And the top studies, this is a summary, the top half of the page all were studies who did not find an association between vitamin D levels and fatigue. And in the bottom half of the page were studies that did find a link. So I think what we can say here is that the jury is out. We still don't know what is happening. We know vitamin D is very important, but we're not sure what exactly is happening with vitamin D and fatigue in lupus. So moving on to now, I think I've convinced you, and I didn't probably need to convince you, you knew very well before, that fatigue is a major issue in lupus. So what are we going to do about it? So we've said that fatigue is multifactorial. So we have to break down what is causing a person's fatigue and treat it step by step, piece by piece. So if a person has active lupus, their doctor should be able to be aware of that and change their immunosuppression accordingly. It's also important to recognize any what we call comorbid or associated conditions. So anemia can be quite common in lupus for a number of different reasons. So this should be identified on a blood count and treated. Hypothyroidism, which is an underactive thyroid gland. One of the main symptoms of that is fatigue. And we see hypothyroidism because it's also an autoimmune condition in about 20% of lupus patients. So it is relatively common and it can be treated with a straightforward medication. So it would be important that that isn't missed. Depression, anxiety, fibromyalgia, and chronic pain that I've mentioned, if those are present, they should be identified and treated as well. So what about psychosocial interventions? So things like cognitive behavioral therapy, counseling, psychotherapy, biofeedback techniques, have they been examined in lupus? Well, yes, they have for a number of years now. So there have been 5 what we call RCTs, randomized controlled trials. These are the best type of trials where you have a treatment group and a control group, so you can really examine what a treatment is doing. And of 5 randomized controlled trials looking at these psychosocial interventions, only 1 showed a marginal benefit in fatigue. They showed benefits for other things, but specifically fatigue, not so much. There have been 2 what we call non-randomized studies, and they showed some benefit in reducing fatigue. Then when they carried out what they called a pooled analysis, that's when you put lots of small studies together or even big studies together. When they looked at all the numbers of all the studies in one big assessment, there was no overall benefit in reducing fatigue with these psychosocial interventions, which is disappointing. These interventions have other uses. They did improve psychological distress for the patient and also help the patient to better problem-solving coping abilities. So they do have benefits, but sadly not directly on fatigue. Aerobic exercise, so I've talked about this a number of times. So we know it's a big link with fatigue. So if we have a trial or a study of aerobic exercise, maybe that will help. So again, this is from St. Thomas's 20 years ago. You can tell it's 20 years ago because the person lying on the couch has a Walkman, which no one has seen in a few years. And the trial was very straightforward. Our clinical trials are much more difficult now, and I can tell you because I've spent most of this week doing paperwork for a lupus clinical trial, and it's tough going. The outcome measures are really tricky and really involved these days. This study was much more simplified, and maybe that was a better approach. So the outcome measures were feeling very much better or much better, so very straightforward outcome. And there were 3 groups: an exercise group, a relaxation group, and a control group that didn't do anything. The exercise group had supervised exercise, and the relaxation group, I think, was this lady here who's just, relaxing. So in the exercise group, half of patients felt very much better. In the relaxation group, a third, and the control group, nobody much felt any different. So the exercise did seem to make a difference. So that is very encouraging. But when the study ended, the patients were asked for a follow-up assessment 3 months later. And in that 3 months, no one was supervising their exercise or their relaxation. So they stopped exercising for the most part. And when they repeated the question, do you feel very much better? Nobody really did. And only 8 of the 33 patients, so only a quarter, were still exercising. And so there wasn't a sustained benefit. So we know that graded exercise, what I mean by graded is you start at a certain level and gradually build up. We know that leads to overall improvement. We know that fatigue improves with exercise. We know that exercise capacity, that's your ability to exercise, improves with exercise. And we actually know, and this is a big concern for patients, we know that exercise does not cause a flare of lupus disease activity. So it's a really important message. So why aren't we all exercising and curing fatigue? Not just in lupus, but in general, but it's easier said than done. This is another study, a more recent study from Belgium, I think. Vaux and colleagues again looked at exercise. They looked at 2 types: home training and supervised training. So, and then they had a control group as well. So both of the intervention or treatment groups had exercise that was walking or cycling for 3 hours a week for 12 weeks. And whether it was home or supervised, there was an improvement in what they called the FSS, the Fatigue Severity Score. So the fatigue improved whether you were exercising in a gym in the hospital or exercising at home, but you were given a program to do yourself at home. So that is encouraging. So if we know exercise helps, why haven't we fixed the problem? So we know exercise improves fatigue. We know that there is no evidence that exercise causes increased lupus flares, but most patients in the studies failed to continue to exercise after the studies were finished. And a lot of patients, especially during the pandemic, obviously, they were unwilling or unable, might be a better word, to engage with exercise programs. So I think we as physicians and lupus teams looking after you need to make a better effort to meet you halfway to see how we can make this more possible. So that's what we actually did in Brooks Hospital in Cambridge. This was led, I cannot take the credit myself, it was led by our lupus specialist nurse, Jane Hollis, and our occupational therapist, Karen Merison, and they developed this Living with Lupus program. And I have to say that they did a really fantastic job. They put a lot of effort into this, and it was very well received by patients. We started this before the pandemic, and it was disrupted, obviously, by the pandemic. We're hoping now to get it running properly again. So this is an example of a poster that we would put up in our outpatient clinic space. So patients would see this, and then they could ring our nurse and say, I want to take part. It was over 4 weeks, a half day once every week for the 4 weeks. You had to commit to the 4 sessions. You couldn't just pick one because it was very much in demand. You had to come to all 4 sessions. So the topics in it were overall information about lupus, the immune system, medications, and then the really important stuff: fatigue management, improving sleep, problem-solving activities. And I'm going to show you on the next page what the program looked like. And you might think maybe everyone was much more fatigued by the end of it because there was so much work, but it was broken down into manageable pieces, which is a key message. So the first week was general introductions, talking about activity, doing some mindfulness and relaxation, and there was homework. The second week, a lot about fatigue, pacing, which I'm going to talk about in a minute, talking about mood and psychological well-being and mindfulness. Again, homework. The third week was a bit more science, medications, how the immune system works, and then a big session about sleep, and then some more guided imagery, relaxation, which the patients really liked. And then the last week was a little bit more patient guided. The patients got to choose the themes they wanted for the final day of the Living with Lupus program. So I'm just going to touch on some of the themes in the Living with Lupus program, and we call these the 4 Ps: problem solving, planning, prioritizing, and pacing. And I must say, the reason I'm in Dublin is I just moved from the UK back to Dublin. I'm still working in the UK for the time being. So we've spent the whole week. This looks quite civilized, but the rest of the house does not look like this. And I wish I'd followed my own advice when we moved this week, because I should have planned better. I should have prioritized, and I should have certainly been pacing myself, unpacking all the boxes. And my problem solving was definitely not up to scratch. So I should really listen to my own advice here. So problem solving is when you have a task that you think is really difficult. How are you going to cope with this? How are you going to get past this and complete this task? It's looking at the problem and seeing how could you maybe do things differently? How can you, there was a song saying it's not what you do, it's the way that you do it. So to do the task differently, sometimes it's about breaking down a task. Sometimes it's about changing your diary during the day. So a lot of us have been working or schooling from home during the pandemic, and we've been sitting in the same position for hours at a computer. We need to problem solve and do that differently to make sure we change our tasks so that we're not uncomfortable and we don't get fatigued. And sometimes you have to ask advice from someone else how to problem solve. But it is a very important thought process to go through. Planning is kind of obvious, but we don't always do it. Taking out your diary at the beginning of the day or the beginning of the week, looking at what are your big tasks for the week. Is there a task on Tuesday, for example, that you know is really difficult, really tough, and that you are going to be exhausted on Wednesday and Thursday and get nothing done on those days, and then feel pretty miserable and dejected and low by Friday? Can you then change that and make the job that you're going to do on Tuesday into smaller parts, or get some help, or just do things in a more paced, spread out way? Prioritizing is, again, an important thing. We often give ourselves an insurmountable amount of things to do. So looking and asking yourself, do these all need to be done today? Maybe I'll unpack those 10 boxes tomorrow. Does it all need to be done at all? Maybe I can cross that off my list. It's not important. Let it go. Do I have to do it? Can't I delegate that to somebody else? People could be more than willing to help. Or could I give some of the task to someone else, but I still do part of it, so I feel that I'm meaningfully involved? So just thinking about these things and prioritizing. Pacing is the really important thing. It's breaking down tasks into achievable parts. So instead of trying to do too much in one piece, breaking it down, taking rest, letting yourself recover. So you'll remember the Aesop, I think, fable of the hare and the tortoise. Slow and steady won the race. So the hare ran ahead, then got bored, got distracted. I think he had a nap. And the tortoise took his time, went at his own pace, took a sensible approach, and actually won the race. So I think that's a very important, very old story, but still relevant today. So again, changing your position regularly, avoiding repetitive activity that makes you uncomfortable, not using exhaustion and fatigue as your signal or your endpoint to, oh, now I must have a break. That's too late. You need to have a barometer to know to have a break before the point of exhaustion. But it's a talent, it's an art to be able to assess that. Now, fatigue, one of the most frustrating things for patients is that it is an invisible symptom. No one else can feel or see your fatigue, and that can be very frustrating. So many people with fatigue feel that they can't talk to others about it, that no one will understand, and that can lead to you feeling very angry and frustrated that someone wants you to go on an outing or a meal or do an activity with them, and you don't feel that you're able, and they don't understand why. But if you don't explain to them how the fatigue makes you feel, they can't possibly guess. So you need to communicate to them and tell them, and then they'll understand more. Increasing physical activity, back to that theme again. It's about not overdoing it too quickly. Start slowly and gradually increase the amount of exercise. So little and often and slowly building. If someone has not been really doing any physical activity at all, and it has been difficult to do that during the pandemic, sometimes guidance from a physiotherapist or an occupational therapist to set goals can be really helpful. Sometimes if someone has a lot of pain, physical exercise is difficult, so a treatment with physiotherapy called hydrotherapy, which is in the picture here, can be really helpful and a good start. Stress and anxiety is something we all deal with in our own ways, but it can really impact on fatigue. So it's looking at techniques, and this was on our Living with Lupus course in Cambridge, relaxation techniques to help you cope with things that you find stressful. So it's about making some time for yourself, carving out a niche of time. And there are, as you know, lots of meditation and mindfulness apps that a lot of people find very useful. So worth a look. The last big topic I want to talk about is quality of sleep. These are not particularly something that a doctor has to give advice on. They're very common sense things, but I think, do we all do these? Do I do these things? Not necessarily, and they are sensible things to do. And sleep really is the most valuable thing. So tips that I can offer you, wind down in the hour before you go to bed. Don't do something very stressful or very exciting before you go to bed, or something that's going to cause you worry and disrupt your sleep. Caffeine in the second half of the day is not going to help. Avoiding alcohol after early evening. So while alcohol might make you feel sleepy, it's actually a stimulant, so you'll wake up in the middle of the night. If you have pain, take a painkiller, be it paracetamol or something else, before you go to bed, or have it on your bedside locker in case you needed it during the night. And then environmental things. Is your room too hot, too cold, too noisy, too bright? Is your bed linen comfortable? Remove any disturbances, as many disturbances as possible. So every time I give this talk and I say that statement, I think of when I gave this talk in Cambridge, and a lady put up her hand at the end and said, does that mean I can kick my husband out into the spare room because he snores? And so that is removing a disturbance. So I think her husband got into a bit of trouble after my talk. A big no-no is mobile technology. Having your mobile phone on your bedside locker, I am guilty of it. So mobile technologies emit a blue light. You can't really see it as such, but it disrupts what's called your circadian rhythm. That's your normal day-night sleep pattern. So it's the thing that is disrupted when you're jet lagged. So just be careful with your mobile phone. It really does upset your sleep. Try to be regular bedtime, regular waking time, what we call sleep hygiene. And if your sleep pattern is broken, it will not be fixed overnight, pardon the pun. It will take weeks or even months to restore a broken sleep cycle. It really requires dedication and work, but it is so worth it if you can get good quality sleep. So in summary and conclusions, and I hope none of you feel like the poor person in this picture after my talk, the summary is fatigue is incredibly common. We recognize that it's difficult to assess. It's difficult to explain it to your doctor, explain it to your family, and it's difficult to manage. Key things are treating the active disease of lupus if it's present, manage comorbid conditions, don't miss anemia, thyroid problems, low mood, or fibromyalgia. Aerobic exercise is so important, but you may need help with that. Sleep hygiene, as I mentioned, and vitamin D may have an important role, and even for bone health, it's good to have a good supply of vitamin D. So that is my last slide. This is Cambridge, the classic picture, the beautiful colleges and the beautiful River Cam. And these are some pictures of our lupus team. As you see, there's a lot of us. Here in the front is probably the most important person in our team, our specialist nurse, Jane, who came up with the idea of the Living with Lupus course. And we have members of Lupus UK, our patient group, who may be on the line, who came to visit us and met us at Lupus Centre of Excellence. And then some of the other consultants that work with us, and a very esteemed visitor, Graham Hughes, the grandfather of lupus in the UK, came to visit us at Cambridge. So that is my talk. I hope you found it useful, and I think there's going to be some discussion and questions.
Thank you very much, Dr. Jordan, for this inspiring talk. I'm sure there, and I saw in the chat already, a lot of questions. So if you can stop sharing your screen. Okay, thank you very much. I will share my screen. Well, still having technical problems, so I will. We will answer. We will ask you the questions from the chat first, and after that, so we will. There are also a lot of questions raised on Facebook, so we will ask those questions later on. I will start with the questions from the chat, and there was one question. The first question was from Gaia, and she asked the following: the light exercise I used is medicine, qigong and yoga, but I still get the fatigue. Then after the flare-up, I feel like I have to start from bottom again, and this goes on like a circle. It is very stressful and tiring. What do you think?
Okay, so yeah, so this is the frustrating thing, as I said, the vicious cycle that you think you're on top of everything. Perhaps your doctor says to you, oh, your lupus is under control or your flare has settled down, but you still feel so fatigued. And fatigue, there will be a baseline level, and then it may be worse during a flare, as you say, as Gaia has said here. And in a way, each time it almost is like you're starting again. But I think the important thing is that she is doing the exercise. She is trying to get going again. Yeah. I think what you're doing is right. But I think it would be important to make sure there aren't other factors, like some of the things I mentioned, like that the thyroid is fine, there isn't anemia or other issues. I think what would be worse, and even though the fatigue might seem bad, I think it might be even worse if Gaia wasn't doing the exercises, the yoga, and the form of, I think it's a form of meditative martial arts that she's doing. I think she might be actually even more fatigued if she wasn't doing those things. So I would say she's doing the right stuff. Would be worth speaking to her lupus doctor to say, is there something there as well, adding to the lupus fatigue? Am I anemic? Is there something else, to make sure nothing's being missed that could be worsening the situation?
Okay, very clear. Thank you. There was another question from Anne, and she asked, if there are no blood tests for fatigue, do you have an idea about how fatigue could eventually quantified, measured in a way that the doctor will take it seriously?
So I think that's again a very important question. So I do quite a few clinical trials in lupus, and what has been interesting in the last couple of years is that, as well as measuring lupus activity, we're seeing as what we call the outcome measure, that what we're studying in these trials are now including more and more fatigue scores. So there's a FACIT fatigue score is one of the scores that we do in clinical trials. So as well as looking at what do the bloods look like with a particular new experimental drug, what do the kidneys look like, what do the lupus antibodies look like, there's much more a focus now on quality of life, particularly with fatigue. So these scores are becoming more, I would say, familiar and utilized by lupus doctors. At the moment, probably more so the lupus doctors that do clinical trials, but I would hope that in time they would drift into regular clinical practice that isn't a clinical trial. So that's a score, like a quantification. What we need then separate to that will be a blood test. So again, in a lot of clinical studies and research, we look at what are called cytokines. So cytokines are inflammatory messengers in the body, things like interferon. If anyone's heard of that, it's quite an important one in lupus. And again, at the moment, most of these cytokines, or what we call cytokine panels, where we can measure lots of these chemical messengers at the same time, are very much things that are done in research or in clinical trials. They're being optimized and perfected and hopefully in time made cheaper, more cost effective. And again, my hope, like with the FACIT fatigue score, is that these type of blood tests would gradually find their way into clinical practice, that they would become a common thing, that when you go to your clinic and get a blood test done, that we have a wider variety of bloods beyond the standard blood tests we have now, and that some of these bloods might give us a better indication about fatigue in lupus. I think it will happen, but it's going to take a bit more time.
Yes, well, I think we all are looking forward to that time. Yeah, thank you. The next question is from Ines. And Ines asks, no, she gives a compliment, but that's also good. She says, this session is being so insightful and simple, and everything is in balance. So let me see. Yes, there's a question from Anne-Marie. What about the alarm clock with lighted numbers? Does this interrupt the sleeping process?
It's interesting. I think that's probably based on the individual. I think if you're a person who's a good sleeper and, you know, people next door might be making a lot of noise and you don't hear it, you sleep well anyway, something like an alarm clock with lighted numbers won't bother you. But if you're someone a bit like myself, a delicate, easily interrupted sleeper, if there was an alarm clock with lighted numbers on the bedside beside me, it would wake me up. So I think it's on the individual, how sensitive you are and how easily woken up you are, and maybe also the kind of state of mind you're in. If you're very relaxed and things are well and you're sleeping well, it might not bother you. But if there are things happening that are going to negatively impact your sleep anyway, I think one more factor, like a lighted alarm clock. Also, if you're worried about the next day, you might be waking going, oh, it's 3 o'clock, it's 4 o'clock, and looking at those little light arms the whole night. So I think it depends on the person.
Okay.
Yeah.
So,
yeah.
But there's no evidence that there's also blue light.
I don't.
Okay.
So I don't think it's blue light that's in the alarm clocks. I think that's a technology that's in mobile phones, iPads, sort of thing.
Very clear.
I think so.
Then there's another question from Juan Carlos. Is there a recommended amount of sleep hours, or does it depend on each person?
Yeah, so that it depends on the person. I mean, you hear of people that can have 4 or 5 hours sleep and they're fully functional and can run the world. And then, like myself, you know, if I don't have almost 8 hours, I'm not really sensible. So it's very much dependent on the person, how much sleep fills their tank. Yeah, but I think we all have our own personal thresholds that we need to be fully functional. It also depends maybe not so much on the amount of sleep, but the quality of sleep. And I hear this a lot, particularly in patients with lupus, but also fibromyalgia. Patients will say, look, I've been in bed for 12 hours. Why am I still waking up exhausted? And it's because they're getting what I call non-restorative or poor quality sleep. And I would kind of describe it like if you're swimming. You're swimming close to the surface, you can see the sunlight. And if you swim down in the deep, it's a different thing. So when you're asleep, if you're at the surface, you're almost half awake. And that's not quality sleep. And if you're sleeping in the deep sleep, the really refreshing sleep where you're out of this world, that is the sleep that is restoring you. So the 12-hour sleep, if it's all full of the light, superficial sleep, it might as well be 3 hours. It's not quality. So it's not necessarily the length of the sleep, but the quality, how good that sleep is.
Okay, thank you. There's one other question from Gaia about sleep. And she says, my sleep is totally different when I have fatigue. I can sleep for 3 to 4 days. Is this normal?
Yeah, I think that's your body's way of getting you back on track. That you know, if your body wants sleep, it means it needs it. And if you need to rest and you need to do that to get back to your previous level of activity, getting back to your yoga, to recover. If your body needs it, it will tell you it needs it. And I wouldn't fight it. I would let yourself have that rest, have that restoration to get you back to where you want to be.
Okay, thank you. Another question from Susan. I have run patients groups for some time. Whenever the subject of pacing is raised, there's a very negative reaction. People try this, but find that because the disease is so unpredictable, activities that can be done easily on one day, on another will cause extreme fatigue, which makes planning of limited value. Can you comment on that?
Yeah, I think that's because what the pacing I might want to do today and the planning I want to do for next week is not going to be the same for if my situation totally changes for what would apply the following week. You know, all our lives change all the time. When you have a chronic illness such as lupus, then the lupus itself is going to change, the medications may be changing. So I think that's the thing, but that in a way is the essence of pacing. So for example, next week, if I'm feeling very well, very rested, in a way you kind of hardly need to pace or plan at all. You naturally fall into a rhythm. So it's an evolving thing. It's not the one plan, the one prioritization is applicable all the time. It has to be constantly refined and changed. So the times when you're not feeling well, the pacing that worked last week is not going to work this week. I think that's the key to it. But I can see how it's frustrating for a person. You're saying, oh, I've paced myself at this level. It was working really well, but now I feel worse. That same pacing is not going to do the job. So I think maybe that's the message to get across. I think it's Suzanne to the group, is that the pacing has to change. The planning has to change according to the day, according to that week, according to what the disease is doing. So I think the key word there is unpredictable. Lupus can be unpredictable. And it's not a plan that's set in stone. It's having to change that plan as and when your body needs it.
Yeah. Okay, there are a lot more questions in the chat, but we also want to give the people on Facebook a chance to raise a few questions. So be sure that the questions that are still in the chat, we will ask them to Professor Jordan by mail or separately. Zoe, you have some questions also from Facebook?
I do indeed. People have been following this presentation with a lot of interest on Facebook and have a number of questions. Mered, I hope I'm pronouncing that right, from Facebook, is asking, are there any reasons for nighttime sweats in lupus patients? As a result, I wake several times, leading to poor sleep and fatigue.
Yeah. So sometimes when lupus is active, people can have temperatures and sweats. So it is worth checking in with your doctor to see, is your lupus active? Another common reason, so, you know, most patients with lupus are women, and obviously all women will, you know, go through the menopause. So is that person perimenopausal? Because that is obviously a very common reason for sweats. So it could be the lupus itself or menopause, but it would be important, as I said, when you're with your doctor the next time to mention it, to make sure there couldn't be any other reason. But certainly having a night sweat could be very unpleasant. You might need to change the bed clothes, your own night clothes, and then you're going to be awake. And so it is worth mentioning with the doctor, but lupus itself, and as I said, menopause could well be contributing. I don't know the age of the person or even that it's definitely a woman, but I'm just assuming.
Thank you. Angel from Facebook is saying, hello all, I have a question. Having this health condition, lupus, I would like to ask you for your advice on how to manage stress and fatigue while working in healthcare settings. I currently work in a clinic and planning to work in a very cold country soon. Can you advise me on this, please? Thank you so much.
Okay. Well, there's no contraindication, obviously, to working in a healthcare setting with lupus. And actually, sometimes if a person has a condition themselves, it makes them a better healthcare worker. They have more empathy, more understanding, and than other people might do. So, you know, you actually could excel in your job. So that would be great. In terms of stress and fatigue, it's again going back to those things of pacing and what you're able for, not overdoing it. If you struggle to have insight into where that is, because I think that's what we all struggle with, is overdoing it and where you cross the line. Sometimes, or very often, and I advise this to patients I have who happen to be healthcare workers or in other work areas, to talk with occupational health. It may be called something else in other countries. So it's usually in a hospital where a nurse or a doctor or any worker in the hospital can go and talk about their medical conditions to a team of nurses and doctors, and they can advise you on your work schedule. They might need to make recommendations to your department that you need, you know, whatever it is, a special share, a half day, you know, whatever it is. But that is usually how this is approached. If you need extra help, is to go to occupational health for their advice.
Brilliant. Thank you. We have a few more questions. So Susan from Facebook is saying, lupus patients take many medications, yet we are cautioned about the use of a mild sleep medication to aid sleep. If the patient adheres to the same dose at night, why can't we have the medication regularly? At least we may be able to have a few hours of relatively good quality sleep. And we have a similar question from somebody asking, are lupus and sleeping tablets okay and compatible?
Yeah, so I think I'm just going to get a bit of water. There isn't, to my knowledge, a specific contraindication with lupus and sleeping tablets. It's just the advice on sleeping tablets in general, that they're supposed to be used kind of sparingly, that if for some reason someone needs them for a short period of time, it's better to use them for that finite period of time. And the reason being that if you're on them long term, you know, they do have sedative effects that can have a knock-on effect the next day. Obviously, it depends on you. Some people tolerate them very well and don't have a side effect the next day. It depends on the dose you're on, the dose you can tolerate, the other medications you're on. If you were on an antidepressant as well, it mightn't be a great combination. So there's a lot of factors there, but it isn't specifically a lupus issue with being on a sleeping tablet long term. It's just, in general, it's preferred that someone isn't on a sleeping tablet long term, but just sparingly or short term. Mm-hmm. And I suppose the reason is, as I said, they can interact with other things and affect driving and machinery operating and things like that. Also, while you might think, oh, why can't I stay this all the time? I guarantee you, in a few months, it then will be the new normal, the new baseline. And then you're like, oh, can't I go on the higher dose? And so on, so on. And I think that's the thinking behind it.
That makes sense. It's like a slippery slope.
Yeah.
Yeah. Thank you. Emma from Facebook is saying, is the recommendation of graded exercise therapy for fatigue in SLE based on different evidence to GET for ME/CFS? I am aware that the draft NICE guidelines for the latter are no longer recommending GET. Thank you.
Okay, so I don't know, is GET graded exercise therapy? Is that?
I think so, yes.
So I'm not familiar with so that was in chronic fatigue.
I think so, yes. ME and CFS.
Okay. So no, I'm not familiar with the NICE guidelines for chronic fatigue. I would imagine the graded exercise is probably quite similar, but I don't know the NICE fatigue guidelines. There are the NICE chronic fatigue guidelines, so I'm sorry, I can't answer that very well. There are good guidelines for lupus from what's called the BSR, the British Society of Rheumatology. It's about treatment of lupus in general, so a lot of it will be more about medications and goals in terms of blood tests and not the more practical things we've talked about tonight. But they do, at the end of their communication, their paper, talk about that all these important quality of life factors should not be ignored. I'm sorry, I can't answer the question about the NICE guidance for chronic fatigue. I'm not familiar with that.
Thank you. We have an anonymous question from Facebook. Somebody asking, is sex before sleeping a good idea for good sleep, or is it too exciting?
It depends. It depends, doesn't it? It could be both. It could be both.
Fair enough.
It could go one way or the other.
It's a difficult question to answer. Thank you. Then we have Danielle from Facebook saying, would you recommend sharing sleep records from Fitbit or similar with your rheumatologist to help look at ways to manage fatigue?
Yeah, I think it may be that your rheumatologist won't understand it, is the problem. I mean, you could, probably the best thing, and I certainly in the NHS in the UK, we're very time limited in clinic, which is the big problem. And I think if you were to show all the records to them, the doctor won't have time to go through that, as well as all the other things they need to go through at the moment. And also now we talk about vaccines and everything else as well. But what you might do is have a little summary, say, look, I've been monitoring this, this is what I've seen. And they would probably be able to talk to you about that. But looking at the whole record, I suspect they won't have time and they probably won't quite understand it. I don't know what a sleep record on a Fitbit looks like, but if it gave a signal that it looked like you had the thing I call sleep apnea with the snoring and all of that, that is something you'd need to tell your primary care physician. But I don't know if the Fitbit gives accurate information to that degree. I'm not sure. If you were attending an occupational therapist, they're the ones that generally give the pacing advice and whatnot. You could let them know about what you found in terms of your sleep pattern. So it's mentioning, but I'm not sure how well a rheumatologist will be able to interpret the sleep pattern, but it would be worth mentioning it.
Makes perfect sense. And then we just have a number of comments from Facebook just thanking you for a brilliant presentation. And a lot of people saying that they hope you stay in Ireland because they're from Ireland and they're very happy to
Yes, I'm here. Yeah. I'll gradually be moving back from Cambridge the next few months.
It was very inspiring. Thank you very, very much.
Thank you.